This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code My DPC Story. A note before today's episode. For those of you who have listened to the early episodes, you know that I'm a podcaster. And what I mean to say by this is that beyond hosting, I love a good quality podcast, and I aim for this with each interview. Before today's interview started, Dr. Berens asked me if her audio is coming across okay, and ironically, her audio sounds like she's in a professional studio, and my part of the interview, not so much. So I'm stating this here so you, the listener, know that I'm aware when the audio leaves lots to be desired, and that I'm striving for better and better audio as we go into the future. Also, I want to address that many of you have reached out asking how you can support the pod and the work that the podcast is doing to help educate, empower, and inspire those in the DPC ecosystem. So here are ways that you can support the show. First, tell someone about DPC. Let's continue to change the culture of healthcare in this country. Second, tell someone about the podcast. Third, leave a review on your podcasting platform. This really helps the pod get visibility to others wanting to learn about DPC. Fourth, add a link to the podcast website or your favorite episode if you feel others could benefit from hearing the stories featured when they visit your website. Fifth, I have put up a donation button on the website for those who want to support with funds. And sixth, I have opened the pod up to sponsors that support DPC. So, if you are interested in sponsorship, please reach out to sponsor@mydpcstory.com to see if we're a good fit. So, thanks for your support and for tuning in. Now, on to today's episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
For me, direct primary care means being able to provide the level of care that my patients deserve without having to sacrifice being the wife and mother that my family deserves. I'm Dr. Rebecca Berens of Vida Family Medicine, and this is my DPC story.
Dr. Rebecca Berens is a board-certified family medicine physician with expertise in women's health and breastfeeding medicine. Her holistic approach serves patients from newborns to the elderly, focusing on both the physical and mental well-being of each family member, perfect for patients looking for a lifetime of care and support. Dr. Berens grew up in the Houston area and received her undergraduate degree in biochemistry and cell biology from Rice University. She continued her studies at Baylor College of Medicine, where she earned her MD, and then she completed her residency training at Providence Hospital, affiliated with Georgetown University in Washington, D.C. She graduated residency as the program's first obstetrics scholar with additional training in women's health and obstetrics. She then went on to serve as Associate Clinical Director at Carl Moore Health Center in Philadelphia, Pennsylvania, before returning home to Houston. She was an associate professor in the Family and Community Medicine Department at Baylor College of Medicine, where she taught medical students and residents while continuing to practice full-spectrum family medicine before she decided to open up her own practice. Dr. Berens provides primary care and chronic disease management for the whole family, but she specializes in fourth trimester care. She is an international board-certified lactation consultant and can provide unique and comprehensive care to new families, including in-home newborn care, postpartum care, and lactation support. She is currently serving as the president of the Direct Care Physicians of Greater Houston, and she opened Vida Family Medicine in January of 2020.
So I want to start with your training because you are both a board-certified family medicine doctor as well as an IBCLC. How did that all happen?
So I was always interested in, women's health, obstetric, maternity care, maternal child health. So breastfeeding was always something I was interested in, but it was sort of always on the medical side. So when you're seeing a patient for the prenatal period or in the hospital after delivery, or in the newborn visits, and you talk about breastfeeding, but it was, I guess, I realize now, very superficial because after I had my son, I realized how little I knew and how much more there was to what I could do in helping patients. So that was sort of what triggered me to, kind of advance my training and learn more so I'd be able to provide that to patients.
And just for the listeners to know, our kids literally are the same ages. So
yeah,
your daughter was born, 2 days before my son?
Yeah, I think something like that. It was super close.
It's just crazy. So when you say that, I feel that to my bones because, I remember when I would talk to people prior to having our first son about breastfeeding and baby sleep. And then you have a kid and you're like, I don't know what the heck I was saying.
Yeah. Whatever the book says is not relevant to real life, I feel like. And it's once it happens to you, you realize how unhelpful your advice was.
100%. I absolutely agree with that. I just, I think back to how embarrassed I felt that first time when I had counseled somebody after having a kid, and it's very, the life education that comes from having kids is just incredible. Now, how did you work those IBCLC hours into your schedule so that you could attain the IBCLC certification?
So the IBCLC hours, when you're a healthcare professional, all of your existing hours that you've spent talking to patients about breastfeeding and counseling and all that, they all count because you already have a lot of the science knowledge and the background knowledge. And so you're already providing counseling. So all those hours count. And then you just have to do an additional 90 educational hours in, learning on a deeper level, I guess, about lactation and counseling new parents. So I already had hours that counted from residency and from my first job after residency. And then it was when I was at my second job, which I started, I guess, 6 weeks before my son was born, and then came back after having had my son. And so while I was out after having my son, I was already sort of interested in this and educating myself more. And so that first year of his life, as I was working at that job, I was, working with postpartum mothers, prenatal, newborn visits, and I was applying all of the 90 hours of education I was getting towards those visits. So all of my hours that I already had counted, and then I kind of just spent more of a focus on it, I think, during the rest of my work as I was approaching the certification.
That's wonderful because, I think that it also enriches our experience as mothers. Just the act of teaching other people about breastfeeding and what you know and about postpartum experience, it makes you reflect on your own experience as well, I feel.
Absolutely, yeah.
When you were transitioning back to Houston and you became an assistant professor at Baylor, what did that position look like for you?
Yeah, so when I first came back, idea behind my job was going to be that I would be working mostly clinically. And I was working in a county health system clinic, which is Baylor staffs a lot of these county health system clinics and the hospital. So I was really just going to be doing like outpatient family medicine. And then whenever we had a medical student rotating, I would, sometimes have a medical student working with me and be teaching them on that side. But actually, while I was out on maternity leave, the one of the core faculty positions at the family medicine residency opened up. So when I returned from maternity leave, I actually went into that core faculty position. And so with that, I was doing not just the outpatient care on my own schedule, but I was also doing resident precepting and rounding in the hospital with residents on the OB service, doing deliveries, doing postpartum rounds, newborn rounds, and doing a lot more teaching, because I wasn't just teaching med students, I was then also teaching the residents.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
And that's a very different ball of wax right there.
Yeah. Yeah. It was, I loved it. I really enjoyed teaching. I had something I always wanted to include in my practice. And my first job out of residency had really no teaching involved. So it was a totally different job than my first job out of residency, for sure.
As you transitioned from residency to the jobs along the way to your DPC journey, at what point did you learn about direct primary care?
So I had heard about direct primary care in residency. I don't remember how I heard about it, but I remember hearing about it. And I remember at the time thinking, oh my gosh, that sounds amazing. That sounds like the perfect job, but I can never do it because I want to take care of underserved patients and I can't do that at DPC. DPC is just for rich patients. So I kind of heard about it. I was like, that sounds cool. Not for me. Moved on. Yeah. And then I just kind of didn't think about it again until after I had my son, and I was extremely burned out and now also postpartum and sleep deprived. And I was just like, I can't keep working like this. I need to find a different way of working or I'm just going to have to quit working. And so that's when I started reading more about it. And I realized actually I can take care of underserved patients in DPC, and it's actually a great fit for a lot of patients. So that's when I started sort of thinking about it again after having my son.
Now, I want to ask about your son and your postpartum experience in Texas. What allowances do you have as a mother and as a father? What allowances did you and your husband have after he was born to be able to take care of your son with your job still being protected?
So I don't know what Texas's overall policy is. I imagine it's probably not great. But Baylor actually had a great policy. So as faculty, you can get up to 12 weeks of sick leave without having to worry about your job, and that's all paid. So I did get, I guess the caveat to that is it has to be like medical leave signed off by your doctor. So my doctor would sign me off for 8 weeks postpartum. So that's how much time I was allowed to take. And then I was allowed to take up to 4 weeks of vacation time. And so I chose to take 2 weeks of vacation time in addition to that 8 weeks. So I got 10 weeks total of maternity leave. And my husband, there's not like defined paternity leave, but it falls into that same, like he also works for Baylor, and it falls into that same like faculty sick leave sort of thing. I think he ended up taking like 10 days, but it was around Labor Day weekend. So we ended up getting a couple extra days there. So yeah, I think he ended up taking 10 days total off. So yeah, it was a whirlwind.
Definitely is. And again, going back to the fact that our kids, and we have two of them, each are the same ages pretty much. And it's, just hearing you say that 10 days, even 12 days with a holiday weekend for your husband and, 10 weeks for yourself, it's just 10 weeks out of a whole year. It really makes you take a step back and think how that's no time at all. I mean, literally, especially with the second child, 10 days is like you blink your eyes and they're 3 months old, right? So with that in mind, did you start having that seed of DPC, maybe I should do DPC, start to grow because you had your son and you wanted to spend more time with him?
I think it was more like I was excited actually to go back to work after having my son. He was a horrible sleeper, horrible, didn't sleep through the night till he was probably like 15 months old. And he was a really bad sleeper early on. And so, I was I was just so anxious my entire maternity leave. Like, how am I possibly going to keep working on no sleep? Like, I just didn't know what I was going to do. And so I was excited to go back to work because I like working and I don't do well sitting at home. I feel the need to be doing something all the time. And like when you're home with a baby, you can't really get much done. I honestly don't know how people who stay home with their children do it because I'm like very task completion oriented and there's no task completion happening right when you have a kid with you. So anyway, I was excited to get back to work because I wanted to like feel like I got something done that day. But I was also just like, I don't know how I'm going to function at work on this little sleep. And so it was I think he was maybe like about 5 months old when I finally was just like, I had been back at work for a couple months at that point and nothing was getting better. And I was just like, there's gotta be an end in sight here. I can't do this forever. And like, I wanted to have more children. And I was like, okay, so this one is still at, 5 or 6 months, not sleeping. If I'm going to do this another couple of times, I don't know how I'm going to be able to function as a doctor. And then also just, not only the sleep deprivation, but also like my work is very demanding. Like I always worked in safety net systems where, it's not just the number of hours you work, it's the amount of energy you're expending when you're working. So you're at work, maybe 9 or 10 hours a day, and you're seeing patients back to back to back that whole time. You don't really take any breaks because even during your like quote unquote lunch break, you're calling patients back, you're, finishing charting, you're cleaning out your inbox. Like there's not actually any downtime. And then you have to go home and there's no downtime at home either. And so you get home and you're already sort of physically and emotionally exhausted. And I just felt like I didn't really even have the energy to enjoy having time with my child. And I was like, even once this baby stage is over, if this is how my job is always going to be, I don't think I'm going to be a very good parent. So I didn't like how I felt when I came home from work every day. And I didn't know how I was going to be able to tolerate that going forward. So that's when I started sort of thinking about alternative career options.
And as you shared, you had heard about DPC and you did realize at some point that you could still take care of underserved people in the DPC model. Had you given thought to any other models in addition to DPC as you were in that space of, there's got to be another way?
So my first job out of residency was an FQHC and I absolutely loved it. Loved my patients, loved the people I worked with, but it was, like I said, very demanding. We were booked every 10 minutes. And I kind of got to the sense of like, okay, this is how FQHCs are because, they get paid the same per visit. So they have to keep the patients moving in and out so that they can, keep afloat. And I was like, okay, so maybe FQHCs are not for me. Maybe I should look for something else. And so that's why I kind of looked for the more academic practice at Baylor because I thought, okay, even though it's still a safety net sort of clinic, there's teaching involved. You're not just seeing patients back to back to back all day, every day. But I felt like it was similar I guess it was similar, but in terms of the intensity of work, but maybe structured differently. So then I was like, okay, so I've tried academics, I've tried FQHC, I could be employed at a hospital system, but that's not really going to be something that is focused on underserved care. And I really don't like the sound of that. Private practice wise, I hadn't ever really seen a private practice that was solely focused on safety net patients. They were always somehow publicly funded. And the idea of dealing with all that red tape and bureaucracy of trying to figure out how to do that just seemed impossible for me to deal with. So I didn't really know where else to go, but I was like, I don't want to just keep trying the same thing over and over. Like, I know how it's going to be. I need to find something that's completely different because I don't know how the current situation is going to, how much longer I can keep going.
Definitely. And at what point did you go full force into DPC?
I spent, I would say, almost a year doing research. So I think I probably was reading and doing research for maybe about 4 or 5 months. Whenever I was up all night feeding my baby, I was like scrolling my phone, reading stuff or, that kind of thing. So I was just doing some reading and like feeling stuff out. I listened to some of the existing DPC podcasts, and that's actually when I heard the other DPC podcast that Landon Russell does. There was an episode. Yeah, there was an episode with Ryan Newhoffel, and he talked about underserved care in DPC. And that was the episode that made me think, oh, like this is actually a viable option for me that I would probably enjoy and could really help contribute to underserved care. And so after that, I talked to my husband about it, and I asked him, I was like, do you think this is something I could do? And the first time I asked him, he was like, what? No. He was like, that sounds crazy. And then I was really upset. And then so I took a few days, and then I asked him again, and I brought him some more information because he had actually never heard of it before. So it was kind of unfair of me to just spring it on him because he had no idea what I was talking about. And so then after I, presented him with some more information and we talked about it some more, he thought that it sounded like a great idea and a good fit for me. So then I started more seriously doing research and like planning. And so that probably took me another about 4 or 5 months or so.
Gotcha. And when you were in that planning stage, did you envision your practice the way it is today, or did your practice develop and you made decisions as you were getting closer to opening?
So I would say it's sort of similar to how it is today. I always wanted to make sure that I had a focus on affordable primary care. Like I didn't want to give up affordable primary care. That was my backbone. But I was also really interested in providing more postpartum care and lactation support. And so I created sort of this like hybrid DPC plus postpartum lactation. So, I wasn't really sure how that was going to look, I guess, when I was first planning, but so that I would say has kind of grown as I've gone. But I think the DPC side, I had a more solid idea of how I wanted that to function.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. Gotcha. And during your process, had you ever envisioned opening with another doctor?
I hadn't. I didn't really know any other doctors who would be interested, and I don't know. I'm not very business savvy. I'll put it that way. I didn't really know what I was doing. Like I I really didn't know what I was doing. I still don't really know what I'm doing, but, but I just sort of was like, I didn't know what was going to happen. So I didn't want, I guess, to have someone else dependent on me. And I wanted to kind of, test it out myself, see how things went. And I will also say I'm kind of a control freak and I like to do things my own way. And I think if I had someone else that I was having to, negotiate things with, I probably wouldn't have liked that very much. So I think it was sort of a kind of thing where I wanted to go into it myself and be able to do things the way that I wanted to and really build the kind of practice that I was envisioning. And then, if down the line, the right person appeared who might be interested in joining me, then that would be great. But it's not really something that I was planning on searching for.
Now, that said, you also have a virtual assistant who helps you out in your everyday operation. So how did you come to a point where you could trust another person with regards to smaller tasks, not necessarily patient care, but smaller tasks in the practice that make your practice functional?
Yeah. So, my assistant, Angie, she is so wonderful. She sort of just fell into my lap at the exact perfect time. So I opened my practice January of 2020. Great time to open a practice. I found out I was pregnant in March of 2020, the same week that my son's daycare shut down. So that was exciting. And so at that point, I knew, okay, I'm going to need to have someone help me at some point, because when I have this baby, I'm not going to be able to do everything myself. And I think at that point, if I first found out I was pregnant, I didn't really know. I didn't have much of a practice at that point. I really had just opened. But throughout the year, it was sort of in the back of my mind, like, I'm going to have to make a plan to do this at some point. And then I would say maybe about late summer, one of the other DPC docs had posted on one of our Facebook groups about her virtual assistant, Angie, and how great she had been at helping her in her practice, how much she had helped her with organization and streamlining processes. And so to me, that just sounded like a perfect fit. Like, this is someone who's already familiar with DPC. She's already worked with another DPC doctor. She already understands the software I'm using. I'm not going to have to do much in the way of training. So I reached out to Angie and I asked her about, at first I said, would you be willing to just help me during my maternity leave? Like, I wasn't really planning on having her long-term, but I knew I needed help during maternity leave. And she was like, yeah, that's great. And then, if you want to continue after that, we can. And honestly, within like the first week of meeting her, I knew I was going to keep her forever, as long as I could anyway, because she's amazing. And she's totally streamlined so many things about my practice. So I think it's one of those things where it's like, if you find the right person, it's easy. Like, it's not hard to trust someone when you know that they're the right fit and they're the right person. But I think going out and having to hire someone from just a pool of random people, that's much harder to trust someone.
Definitely. And it helped that you had that recommendation from someone who's already doing DPC and that she had experience with the EMR, like you're saying. Now, when you were on maternity leave, did you and Angie work together to generally talk about what you needed help with? And then she helped streamline the process? Or how did you guys get to functioning as a team like you do today?
Yeah. So my baby was due November 12th. So I started with Angie around the end of October, beginning of November time. We started, meeting, and I kind of described like, okay, this is my general process for how I do, onboarding and marketing and, day-to-day patient communication and administrative stuff. I kind of just ran through with her how I was currently doing things. And then she gave me a lot of suggestions based on her experience using the different software that I use and how things have worked in other practices, of how those things could be streamlined. And then we just kind of came up with a plan of how we would handle things while I was out. So I had a sort of like a marketing strategy that I was using, and I wanted to keep going while I was out. And she kind of just picked up the parts that she could and took over meet and greets and took over helping patient with onboarding and that kind of thing. We created a wait list of patients who would be ready to be scheduled as soon as I came back from leave. And so she, it was a team effort really, of me telling her what I needed and her amazing organized brain just coming in and saying, okay, this is how I think we should do this. And yeah, so she really had a lot of strong strong background and strong just organizational skills behind her that really helped come together with what I was hoping for. And it worked out perfectly.
And when you mention how she helped with onboarding and meet and greets, what did that look like what did that look like from the patient's perspective?
So at the end of October, when I was just about, ready to wind down, I wasn't accepting any more new patients. I changed all the spots on my website. When someone clicked that they wanted to join or wanted to schedule a meet and greet, it would go to a pop-up that would say, we currently have a wait list. We're accepting patients for the wait list. Please enter your information and we will contact you. And so people would fill out the contact form, and then Angie would reach out and give them information about the practice in general, let them know that I was on maternity leave and when I was coming back, and asked if they wanted to schedule a meet and greet to decide if they wanted to pre-enroll. And then if they wanted to schedule a meet and greet, she would schedule that with them and she would talk to them about the practice. And she was incredible. And she had like 20 people signed up by the time I came back from maternity leave. Her conversion rate on meet and greets is significantly better than mine. So she was amazing.
That's fantastic. Looking back, knowing that, like you said, there is a part of you that's wanting to drive the ship. Absolutely. But there's also this part of you who has released some of the things that you now trust Angie with. Would you rather have opened with a virtual assistant from the get-go?
Yeah. So I think the timing was actually perfect for when I brought on the virtual assistant. I think when you first start a business, it is really important for you to do everything so that you understand how everything works. Because I think there are some people who start businesses and they have, someone that starts with them who takes care of a lot of the administrative stuff. But then if that person leaves, like what happens? You don't understand how your own business works. And so I do think it's really important that I started by myself to really understand how everything works, how I wanted everything to function, and how how works best for me to handle the practice. And then once I grew a little bit and had, more patient care things to do, it doesn't make as much sense for me to spend time doing that administrative stuff once we're sort of in a groove. So, and I definitely have grown in my control freakness through the course of the business, because what I've learned is I am not good at a lot of things and I'm not good at them. And it's cheaper for me to pay for someone else to do it while I do more valuable things that I am good at than for me to try to do it myself, do a really bad job and waste a ton of time and money on it. There's people who have expertise in a lot of areas that I don't, and I should not try to recreate the wheel there. Like, it makes a lot more sense for me to delegate that stuff to people who are much better at it than me. So yeah, I mean, I wouldn't do anything differently. I think it was important that I learned that lesson. But now that I've learned that lesson, I am like actively looking for other things that I can delegate, because there's plenty of things I am bad at that other people excel at. So
it's interesting though, because I think about a fee-for-service clinic, a doctor has somebody schedule, has somebody, do the vital signs, has somebody do the lab draw. And then a DPC doctor, especially if you're a micro practice, does it all. And then that idea that, because I think that's very smart, the idea to open and know everything that's going on in the business, but then migrating to the space of now I can be more comfortable with giving duties to other people that I don't necessarily need my medical degree. It's very interesting, because it's almost like this, you have to leave to be able to appreciate what you had when you go back to that space of, I'm going to honor the education and the knowledge and the training that I have as a physician, So
absolutely.
One of the things that I found very interesting was because I like to do this prior to interviewing, is I Googled your name and you came up on the Google search as female primary care doctor, even before Vida Family Medicine was listed. And so I want to ask about these magic SEO skills that had to have happened for that to appear on Google. So please tell.
So it was not my SEO skills, I assure you. I have none of those. Again, one of the other things that I quickly learned I needed to delegate was marketing. So when I first opened, I had this absurd belief that I could just like post some ads myself on Facebook and Google and it would be great and it would totally work. I don't know where I got that from. I think I'll be honest, like in some of the DPC Facebook groups, I think a lot of the people who have been in practice a long time they forget what it was like at the beginning, maybe, or they had other skills that they didn't realize other people don't have. I don't know what it is, but people will say things like, oh yeah, Facebook is so great. You can get so many patients, just post stuff on Facebook. No, that's not how it works. So I realized, several months in that I needed someone to help me because no one was finding me and I didn't know how to market. So again, I hired someone. I hired actually Josh Bubb. He's the husband of Rebecca Bubb at Pure Family Medicine in Colorado. And I hired him to help me with Google Ads. And I could not afford to also hire him to help me with SEO and other things that I needed. But he was very kind to give me some tips about just like little things I could tweak on my website that would help with SEO. And I didn't even realize this was a thing, but my site is made on Wix, and there's for each page on your website, you can go in and you can type in these SEO titles. And I think that was one of the things he told me I should type, because I think he said that that's sometimes what people are searching is they're looking for a female primary care doctor. And I was like, oh, that makes sense. So yeah, so he was the one that taught me about that.
I love it. And it's, Google's going to have their algorithm. We got to work the algorithm to our favor. So congrats on that, because it worked.
Wonderful. I'm so glad to hear that.
I hope everyone's jumping on their computers and Googling your name right now, because it's amazing. It's right there. Now, what about your name and logo? How did your name and logo come to be?
I perseverated about the name for a long time, like longer than was probably necessary. I really wanted to communicate that I see patients of all ages. So I wanted to like communicate like across the lifespan sort of thing. And I wanted to communicate that I spoke Spanish, because I felt like that was an important, skill that I have that I can offer to my community that is not, it kind of sets me apart from other clinics. And then I also wanted to communicate that I want to look at the whole person and their whole life rather than just pieces like their medical problems or their medications or your lab result. I really want to look at someone's whole life and their whole personhood than just their medical side. And so, I started taking Spanish when I was in, I think, 7th grade. And I absolutely love the Spanish language. I think it's just the most beautiful language. I love the art. I love the culture. I love all of it. So that word vida, which means life in Spanish, just really spoke to me as communicating all of those things. And I didn't want to use my name because I didn't want to box myself in case I did want to have other people join me later. I didn't want to tie myself too strongly to any particular location. So I needed to have a word that was not any of those things. And that was the word that kind of spoke to me as communicating everything I wanted it to. And then in terms of the logo, once I had a name, I reached out to actually Kissy Blackwell's cousin, because I loved Kissy's website. I had kind of trolled a lot of different DPC websites to kind of see who made them so I could get a sense of who would be a good fit for me. And I loved her website. And then I found out it was actually her cousin who designed it. And so she's in Houston, she's local. So that was a huge plus as well, because I wanted to support like a local business owner in making my website. And so I reached out to her, and she does like a whole branding package where she does the logo and the website design and business card design and kind of all in one. And so for me, that was a really good fit to just get everything all done at once and not have to worry about it. Yeah, she came up with that logo design and I loved it. It was perfect for what I wanted to communicate. So,
and with it being on a Wix platform, did she set it up so that she got it up and running and then now you run it from after she handed it over, after she had finished developing it?
Yeah, exactly. And that was one of the things I really liked about her too, is I knew that again, I'm a control freak. I like to be able to do things myself. So I didn't want to have to, call someone every time I wanted to make a little tweak to the website. And I'm tech savvy enough to know how to do things. Like, I couldn't go in and build my own site from scratch, obviously, but now that it's up and running and there's a structure to it, it's very easy for me to create pages or change pages without altering the fundamental design of the website. And so, yeah, I really like that aspect because it's easy for me to make adjustments when I need to.
I totally hear you. And especially Wix, I find that because that's what the mydpcstory.com page is also built off of, it's much more feasible, I feel, to do something like that than to develop all of the code on the back end of like a WordPress site. So I think that's a great, marriage of two aspects, like your ability to continue the development of your website, but to have had Kissy's cousin develop it from the ground up to that point where you could take over. So I think that's really, really smart. And, as like you said, you don't have to reach out to somebody every time you need a change, because I mean, when we're typing things at 2 a.m., sometimes there's spelling errors, and it's really annoying, the idea to think that you have to for me at least, to think that you have to call someone to fix, the way that if you misspelled a word even. So
yeah, absolutely.
Now, what is your patient panel currently like?
So currently I have 78 active patients, and I think I have about 6 or 7 that they've signed up, but I haven't seen them yet. So I haven't activated their membership. So yeah, so we're beginning of March, and I'm at 78 fully active.
And looking back to when you opened in January of last year to now, did you envision a particular growth plan?
So my goal for when I opened was that I would be at 100 patients at the end of 2020. And I had based that off of, just sort of reading other people's experiences and, the expected growth in a year for the first year. And I felt like that was a pretty reasonable target, because I figured, the first couple months will be slow and then growth speeds up as you increase your number of patients, and then you get a little bit of word of mouth going and all of that. But obviously that didn't happen. 2020 did not go even remotely how I thought it would. So I, mid-March of 2020, I found out I was pregnant and that my son's daycare was shutting down because of COVID. Like, I think on the same day, if not within a week of each other. And so I had to change some processes. So basically March through pretty much the end of May, I stayed home with my son all day and had limited time to do any work on the practice. I think I had maybe 8 or 10 patients at that point. So it wasn't like I had a lot of patient care responsibilities day to day, but I wasn't really able to focus much time on growing because I couldn't have seen new patients in the office if I wanted to, and I just didn't have time either. So, my son was taking one decent sized nap per day, usually about an hour and a half to 2 hours. So that was my time in the day to get work done. And then sometimes, like in the morning, I usually would take him out on a walk around the neighborhood. And maybe while we were walking, I would be on a call with someone, trying to do some networking in the local community. But that was pretty much the only time in the day that I had to work on anything. So it wasn't really until June when I finally was able to. My mom, she works for a school district. She was out of work, and so she was able to watch my son more consistently. And so then I was able to actually start getting back into working again and kicking the practice off. So then I kind of reframed my goals, and I decided that my goal was to be at 50 patients by the time I had my baby. And I was lucky enough to get to 55 by the time I went out on maternity leave. So that was great.
I when you mentioned the 1 to 2 hour naps, I miss those times so much because
Yeah.
Those were absolutely the most productive times. Like, second baby hasn't popped out yet and the other one's asleep. So literally it's like you time, and you can figure out what you need to do and get that stuff done. So it definitely highlights the reality of being a parent, especially in 2020. It was a tough year for people in different aspects. And so that's wonderful that you took a step back, you looked, reevaluated, and then you still achieved your goal before your daughter came out. Now, looking back to the opening until now, given that you have already celebrated your 1-year anniversary, I will congratulate you on that, because that is a huge benchmark for every aspiring DPC doctor who is, in the planning stages, and for those DPC doctors who are inching, closer and closer to that goal. When you look back on the past year with maternity leave, with the pandemic, with you having to, redirect your parenting to being at home with your son rather than having your son go to daycare, how was that for you?
I mean, I would say it's an education in becoming flexible, because I'm not a very flexible person at my baseline. But I think it was really important for me to have that experience, because now pretty much no matter what happens, I'm like, okay, we can reevaluate, we can adjust, and it'll be fine. And I think there is a time in my life when all of those changes happening at once would have just completely thrown me off. Like I would not have been able to come back from it. But now I'm just kind of, every day it's like, okay, we'll see what happens today and we'll deal with it and we'll move on. So yeah, I think it was obviously not how I would have preferred my first year to go, but now that it's happened, I don't feel like it can get too much worse, knock on wood. So now any other issue that comes up in my business or, roadblock that might appear, I feel like I can find a way around it, and it'll all be okay.
Now that you're almost at 80 patients, are you practicing DPC as your full-time job?
Definitely not. So, I think I was able to break even on like covering my overhead at about 35 patients, because I try to keep my overhead very, very low. But I'm still definitely nowhere near the point of being able to pay myself. As I've grown, obviously I've incurred some expenses and had to increase my overhead a little bit, which I think still supports my overall goals, but is a little bit, I'm still just definitely nowhere near being able to pay myself. So I did have plans for supplemental income while I'm going through this growth process. Initially, my plan was I was going to be working part-time at my previous clinic. So, working maybe 1 or 2 days a week there on like a PRN basis. But then when COVID happened, they no longer needed me. So I had to find some different options. And I was doing a variety of sort of random little telemedicine jobs throughout the year. When COVID first hit, there was a lot of telemedicine platforms that were really needing people to join. And so I did join several of those different platforms and was doing sort of like intermittent telemedicine work. And now I have a more consistent, pretty much half-time telemedicine job that's 20 hours a week. So I'm able to do 20 hours a week for them and then 20 hours a week for my own practice. And because I have, the support of Angie and I'm able to outsource a little bit more of my administrative work, it balances out pretty well. And I'm actually able to contribute something to my family this year, because last year did not go that way. So.
And how are you managing with childcare?
So we decided to hire a nanny late last year. We loved my son's daycare. It was such a wonderful place, and it's really close to our house. It was like the perfect daycare, but we just didn't feel comfortable, particularly while I was pregnant, sending him to daycare and with the risk of COVID exposures. And so we decided when my mom had to return back to her school job that we would hire a nanny. And she is just a godsend. I love her. She has been an amazing addition to our family. And especially now that we have 2 kids, daycare with 2 kids is basically the same cost as a nanny anyway. So you might as well have a nanny because it's so much easier. Like I remember with my son, we used to have to pack a lunch and pack bottles and pack extra clothes. Like every day you're like packing a suitcase to send with him to daycare. And then you'd have to wash everything and do it all again the next day. It was like adding an extra set of tasks to your day. Now I don't even wake my son up before I leave in the morning. She wakes him up, she gets him ready, she gets him breakfast. Like my mornings are so much less stressful now. So it's been great.
Awesome. And in terms of the balance between your hours in your clinic and then in your other positions, how does that all work with scheduling, especially for your patients in your practice?
So the telemedicine job is really ideal because I'm able to set my own hours. So I basically do 4-hour shifts, and I'll do a 4-hour shift every day, either in the morning or the afternoon. And that allows me to still be able to have availability every day for my patient. And so then if something comes up, someone needs to be seen the same day, Angie can help, get them on the schedule so that they're not experiencing any interruption in their care with me because I'm working at this other job. It's also great as a postpartum job because I'm pumping, and trying to find a part-time job that is okay with you taking a break to pump is impossible. So I'm able to, continue working while I pump, and it fits in perfectly into my day, doesn't create any additional, commute or anything like that. So I sit at my desk in my office, I do my telemedicine shift, then I log off and I see my DPC patients and do DPC work. And then I go home, and it's great.
That's really great because you're able to balance both, and yet your patients are still getting that personalized care with Angie. In the beginning, you said how you enjoyed incorporating women's health into your practice. And then after you open your DPC doors, how much of your time is spent doing women's health?
So I think my plan was to more heavily advertise the fourth trimester and the lactation care, with the idea that would then, patients would maybe see me for that and then convert into DPC patients going forward. Once I found out I was pregnant, I felt that I needed to focus more on the DPC side of things, because the fourth trimester package that I offer is very high touch. There's a lot of in-home care. There's a lot, it's a lot of discussion because there's a lot going on in that period. And I didn't want to have people coming on board when I was going to be out on maternity leave and not able to provide that same high touch experience. So, DPC patients, I was able to still, text with them and do an occasional virtual visit and all that while I was on maternity leave. It was no big deal, but I don't think I would have been able to offer the same level of care to a fourth trimester client in that time. So I didn't really focus as much on it. Now that I'm back and my fourth trimester is over, I think I'll probably focus a little bit more on it this year. But I think just the fact that I offer it and I have that expertise, I tend to attract more female patients in general. So even though I'm maybe not doing as much postpartum care and lactation support, I'm doing a lot of primary care for female patients because they're seeking out maybe a female primary care doctor or a primary care doctor who has an interest in women's health. So I still do a fair amount on that side. And I have had several sort of one-off lactation consults. So maybe not necessarily the full package, but patients coming in who are having maybe a breastfeeding related issue and want to do a one-time consult. I've done a few of those.
It's a totally different take on medicine, DPCs in general, but also if you're on maternity leave and doing DPC, you don't have to not partake in your job because you're on disability or, FMLA or whatever it is in your state. So I think that's so incredible that, your patients maintained their membership while you were on maternity leave or in a fee-for-service clinic. You can't talk with your patients if you decide to take a true funded maternity leave.
Yeah. I mean, that was huge for me because with my first maternity leave, I actually was still checking my inbox every day because, like I said, I'm that kind of person who's a control freak and I wanted to know what was going on. So I was logging into my inbox every day and just checking things and then sending messages to nursing to call patients. But I really wasn't doing a good job of balancing those things because it wasn't set up for me to be able to do that. Whereas this time around, it was very seamless. I actually, when I was in the hospital, I had to be induced this time. And at the early part of my hospitalization before anything was really going, I actually was I took a couple phone calls from patients and the OB walked in during one of them and she's like, "Are you really working right now? You're obviously not uncomfortable enough to be in in labor. We need to be moving along. And, but yeah, I mean, it was very seamless because I was able to control what time of day was best for me to work, and patients weren't really getting passed off or missing out on anything. You know, I was just able to move things around to fit what worked for me and my family. And my patients were so respectful as well. Like there were so many of them that they texted me and they said, "Oh, I'm so sorry to bother you. You know, I know you're home with your baby, but," and I'm like, "No, this is my job. Like if you need to get a hold of me, that's the point." And it really was never a major interruption. You know, I took care of what needed to be taken care of. And obviously we had time to plan. Like I told people, this is when I'm due. So if you need stuff, let's do it now before I'm due. So most of the routine stuff was taken care of. And it was just like a couple of cute things that came up or people that needed quick follow-ups. And we were able to do that. And it really wasn't a big deal.
And while you were out on maternity leave, did you have any instances where people needed to be seen in person, and what happened with those patients?
So I actually think I only had one patient that ended up needing to be seen, and she was still able to be seen virtually, but it was while I was in the hospital. So I had a wonderful group of local DPC doctors in the Houston area who I didn't even have to ask. They just volunteered to help me during my maternity leave before I even asked, you know. So I had several doctors who Angie had all their information, was able to get a hold of them if I had a patient that needed something and I wasn't able to help them. And they were, you know, she helped them out. They got set up with an appointment. It was no big deal. And, you know, they sent me their note afterwards, and everything was perfectly continuous. It was great.
That's awesome. That's so wonderful to hear. Now, I wanted to ask if you can give us a little bit more detail about what does a fourth trimester package look like to a patient in your practice?
Yeah. So the idea is for them to have more hands-on care during the fourth trimester. So the first 3 months after they deliver, because you know, the traditional system, you maybe get a 6-week postpartum visit and that's it. And the baby has, you know, their visits with the pediatrician, but that none of that care is very integrated unless you're seeing a family physician for your OB care and your pediatric care, which is increasingly rare these days. Your care is not really integrated with the babies. So the goal would be for all of your care to be integrated and done in your home. So you're not having to, you know, carry a car seat up the stairs to the doctor's office 2 weeks after having a C-section. Or, you know, if you're struggling with breastfeeding and you're sleep deprived and you're, you know, just exhausted, the last thing you want to do is like get in the car and pack the diaper bag and take yourself and the baby out to some hospital where you have to pay for parking and then navigate through the hospital, get to a lactation consult or, you know, whatever. The idea is everything comes to you in your home. Mom's taken care of, baby's taken care of. And if there's any breastfeeding issues that need to be addressed, those can be addressed as well. And it's all in one. So I include basically the same thing as all of my DPC patients get. So as many, you know, office visits and virtual visits as they need, but then also 3 home visits are included in the package. And then if additional home visits are needed, then that can be arranged as well. And it's just like with DPC, whatever care you need is included. And that's kind of it.
Awesome. And do you have a separate pricing for the people who are getting fourth trimester care?
I do. Yeah. Because it's much more high touch. And there's a lot more going on. The pricing is different. And I mean, I'll be honest, I haven't really had anyone sign up for it. So right now I had one like remote client that signed up for it who I helped her remotely, but obviously she wasn't getting the same in-home care. So obviously I didn't price it the same as I would if I was going to her home. So it's been a work in progress. I'll have to see how that goes as I have more interested clients.
So what about in terms of women's health? What about procedures like IUDs? How do you get that? How do you get coverage for something like an IUD or Nexplanon so that women's health so that you can morph women's health in with serving underserved patients and while still doing procedures?
So the patients I've had so far who've been interested in IUDs, one of them did have insurance and we were able to order the IUD through her insurance, and it was not an issue. The other patients I've had who've been interested qualify for patient assistance through the pharmaceutical companies that make the IUDs. So we've been able to get them that way, and it hasn't been too much of an issue. Patient assistance, I don't think is available for Paragard or Nexplanon. It hasn't come up, but from what I understand, it's not available. So it's kind of, I'm going to cross that bridge when I come to it. But so far, I've been able to do everything patients have needed without an issue. But certainly, there's plenty of community sites that I could refer people to if there was something that we weren't able to get handled for them in my office. But I would obviously like to be able to do it all for them in my office if possible.
What about, I'd like to ask this of all of the Texas doctors, but how are you handling dispensing of medications in your practice to your patients?
So I don't dispense anything to my patients. In Texas, I think you're allowed to dispense, I think it's up to a 3-day supply. And to me, it's just not worth the hassle. It's really easy, especially in my area. There's plenty of pharmacies. The grocery store pharmacies offer really great pricing on medications. There's also a locally owned pharmacy really close to my office that I've gotten to know the pharmacist there. And they offer great pricing for my patients for generic medications. So it's just not worth it to me. And honestly, even if Texas all of a sudden decided to allow dispensing, I'm not sure it would be worth it for me because pricing that they're getting at the local pharmacy is not bad. And I would have to, manage all this inventory. It would be a whole other set of admin tasks for me that wouldn't really be that much of a value add for my patients. So I just hasn't really been something I've been interested in.
So Sunil Vasishta and Dr. Rao talked about their experience a little bit, but being the president, could you explain what the Direct to Care Physicians of Greater Houston group is, and what are you doing? What are you actively doing as a group for direct to primary care?
Yeah. So the group kind of grew out of, it was not planned, but when I first opened, I reached out to all the Houston DPC docs through the Facebook group. And I was like, hey, does anyone want to get lunch with me? We should all get lunch together and talk. And so a bunch of us met up at a restaurant near my office for lunch. This was in January, pre-COVID. And we all had such a great time getting to know each other. And there was just so much that we could share with each other in terms of sharing resources, referral physicians that we trust, and even supplies. If one of us buys a huge box of something and we don't need all of it, we can split it amongst a few of us. So that's kind of how it started, was just as a way of us meeting and socializing and supporting each other. But I had this idea of, combined, all of our efforts could be really powerful for marketing. Each of us individually doesn't have a huge marketing budget, doesn't have a huge, marketing team that we can rely on. But if we all combined our efforts, we could really expand knowledge of DPC in the Houston area. And, a rising tide lifts all ships. If we're all helping each other, it's going to help all of us. So it kind of grew out of that desire for us to have a collective effort of educating patients in the Houston area about the model, and then giving them a way of finding a practice that would work well for them. So, initially there wasn't really a plan to formalize anything. We were just we should just help each other out and make this, but I decided that I thought it'd be a good idea to have a website where kind of like a mapper, the other DPC mappers that exist, but just for Houston, where a patient could go in and find, a practice near them, research the practices in the area, find a doctor who would be a good fit for them. I was like, oh, well, we should make a website. And so then that led me down this rabbit hole of okay, well, who owns the website? And then you kind of have to have an entity who's in charge of it. And I didn't feel it was right for one clinic to own the website, because then if there was some issue in the future, that would be a big contentious problem. I didn't want to deal with that. So we decided that we would form a nonprofit. And the nonprofit would own the website. And so then we all collectively would own that space on the web, on the web, and we could use social media to promote that website, and we could all sort of collectively be a part of that effort. So we decided to create the nonprofit, and it kind of has multiple goals. So one is this public education and patient education about the direct care model. But another is also educating and supporting physicians. So like residents, medical students, physicians who might be interested in the model this is a centralized way for them to reach all of the physicians in our area and learn from us and for us to support them. So it's still very much in its infancy. We have the website up and running, and we had a big social media blitz when we first launched it. And that was timed with my pregnancy coming to an end and, the end of the holidays and all of that. So things kind of got derailed. And then, we were planning to start fresh this year. And then our first meeting in February didn't happen because of the ice storm. So we're meeting next week, and I'm hoping that we're going to get off on a better start for the rest of 2021 and really be able to promote the website and start to do some of that collective marketing and education that we were planning on. We also had planned to sort of use the nonprofit as a way to collaborate with each other through a single entity. So for example, companies like VaxCare, if you want to use their services, you have to run it through one centralized entity. And each of us individually doesn't have the volume to have a contract with VaxCare, but as a group, we do. That unfortunately didn't ever come to anything, but that was sort of another idea that we were planning to use the group for. So I'm sure there will be other things that will come up in the future where all of us together can sort of collectively bargain through this entity to get the services that all of us need and support our individual missions.
I think that's great because like you said, a rising tide floats all ships. And if you guys are actively, more and more you guys are actively putting the word out there about DPC, the more likely someone is about to hear about DPC or potentially join a practice. So I think that's really smart. Now, you also mentioned the ice storms, which were just harrowing. In terms of your practice, have you had any people contact you because of health needs that have come up and they are unable to get care because of COVID going on and so many people experiencing, their homes being literally destroyed by what happened? Have you gotten any calls because of what happened with the ice storms?
So through my DPC practice, no. I do have several patients who were severely impacted. And of course, they've had health needs come up as a result of that. But my practice, I haven't received any calls, for that reason. But I will say through my telemedicine job, I was working when I had power that week on telemedicine. And there were a lot of patients in that situation. And it really did speak to me at that point where I was seeing these patients through this telemedicine platform, and they could have benefited so much from having a DPC doctor in that moment. And they just probably didn't even know it existed. And I was really grateful that through that telemedicine platform, I was able to help people because I was helping people all over the state. Not just in my local area. There's a lot of people in rural areas that have even less resources. And telemedicine really does allow you to reach those people. But it did give me that sense of like, this is why it's so important to educate people about this model, because in situations like that, it can be so life-changing for a person to have access to their doctor in that moment. Hopefully with our group, we'll be able to reach a greater number of patients and teach them about the model because, we have such a high uninsured rate in Houston. I think it's about 20% almost. And so those are patients who don't have access except for, maybe a walk-in clinic, an urgent care, one of the safety net clinics. They're not getting access to a consistent primary care physician without insurance. And so it would be so life-changing for a lot of those people to be able to access care through a DPC type model.
Along with losing jobs because of COVID, I would assume that people are going to, decide I'm not going to go to the doctor because I have to put food on the table. And then chronic issues can become worse if they're not looked after. So I hope that more people quickly learn about the model through you guys, and that they're able to benefit from your services as patients in your clinic, as well as the DPCs around you.
Yeah, absolutely. I mean, I think this year has been so hard for so many families, and this is just going to be one more stressor.
For your practice, are there any particular tools that you use and love that you would recommend to others?
So Spruce is amazing. I love Spruce. Could not run without Spruce. And Angie has taught me all these things about Spruce that I never knew, because I loved it before, but now with all the stuff she's taught me, I love it even more. So it's just great. Like, I can't actually imagine doing DPC without Spruce. And then this year for my online scheduling, I switched from the built-in Elation scheduling to Intake Queue. And I had actually debated starting with just Intake Queue and nothing else. But I didn't, because I felt like I needed like a real EMR at the beginning. And Intake Queue, while it's great, it does not have all of the functions of real EMR. But so I didn't start using it until this year, because I had several patients who had issues with Elation Passport, like couldn't figure it out. I had multiple issues with like password reset problems and just multiple issues with it. So, decided to go with Intake Queue for the online scheduling. And then also it has a lot of intake forms. And it's really great. I love it. It's easy to use the scheduling. They don't have to have a password to remember, so there's no password reset issues. And it syncs really well with Google Calendar. It's wonderful. And their intake form system is so robust. Like, you can do literally anything with it. You could even actually probably bill a subscription through it. I don't. I use Hint just because I was already using it. But it's actually really great for my lactation visits. Like, I can bill through it for those without having to put those patients in Hint. Because it's just you can do it through Hint. It's just a little bit less intuitive. Whereas through Intake Queue, like, they can just go in, click that they want to schedule a visit. It'll automatically send them the intake forms. It'll automatically get their credit card on file. And then when I see them, I can just charge their credit card and it's no problem. So I've really been loving Intake Queue this year. And I do wish I had started with it, because I think it's perfect for when you're just starting out and you don't really need all of the features yet.
And are you using, when you mentioned integration with Gmail, are you using G Suite?
Yes, I use G Suite for my email, my Drive, like all of that stuff.
And again, looking back at where you've come from and where you are now, especially if a doctor had a newborn or little ones at home, what advice would you give them if they were looking into opening versus if they've already opened and are wondering, how am I going to survive?
So I think, not to sugarcoat how DPC is, because like, I think there is this sense of like, oh, everything's great all the time and it'll be totally wonderful. You'll open and you'll get patients and your life will be great. It's a grind. Like, getting to the first 50 patients is a grind. Like, there were so many times that I was just like, why am I doing this? Why am I doing this? But then, during the pandemic, if I had been working a regular job, I actually don't know how we would have managed, because we would have had to just keep sending my kid to daycare. And I would have been, exposing myself while pregnant at a regular job, then exposing myself through my son from daycare. Like, I really do love having the control, but you have to recognize that comes with a lot of sacrifices. So, like I said, I did not pay myself a cent last year. In fact, I think, God, I don't even know how much money I put into the business. I don't even want to think about that. Negative money from my practice last year. Not to mention, then we had to hire a nanny instead of daycare. So last year financially did not go well for us. If I didn't have my husband, who's also a doctor, with some income, I don't know what we would have done. And, we still have my student loan payments. We still have mortgage payments. We have a lot of payments every month. So it's important to be financially prepared for anything and have a plan and, reduce your personal overhead as much as possible when you're coming into a practice. But I think there isn't another job you could have that would have this level of control while you're a parent of young children. Like any other job especially in medicine, is not family friendly. And you can't just, take off days when your kid is sick, and you can't just, make changes to your schedule at the last minute if something comes up. But with DPC, you really can. And I think for me, that was kind of what kept me going is, once my kids are in school, I'm going to be able to take the day off to go to their play that they put in the middle of the day for none of working parents to be able to attend. There's just things about my life that will be so much better for me and my kids once things are stable. And I think, when they're babies, they don't remember. So right now, even though I'm working a lot of hours and, it's maybe not perfect all the time, they are not going to remember. But when they're older and I have a little bit more stable situation, that's when it really will count. And that's kind of what keeps me going.
I just love that, though. You're thinking as a mom in the future, and you're doing what you can now to make that future actually happen.
Yeah. And what is also wonderful about DPC is, I think I mentioned this, when I went on maternity leave, my patients were they were so happy for me. I got emails like, how's the baby? Oh, she's so cute. Cause I sent them all a picture, really sweet, nice comments like that. Not you would get from your job, when are you coming back? You mean you're taking another pump break? Blah, 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 just very different responses to how you would get at a regular job. My patients are never going to say anything negative or mean to me. We're all I feel my patients are like my family, and I treat them that way, and they treat me that way as well. It's not like a job where you're just a body to produce RVUs to, meet some bottom line somewhere. It's not like that. It's very different. So I really appreciate that about my job and my patients.
And do you ever think that your husband would come join you?
I don't think so. He has a very unique job, that is perfect for him, and is kind of he got pretty much his dream job out of residency. He does clinical work and he does research, and so I can't see him leaving his job ever, honestly. So I think he's very happy with it. And, I don't think that DPC would meet all of his job needs.
Having that outlook, and that, as we all do, but I think sometimes it gets forgotten that DPC is not for everybody, right? So for some people, it's the perfect fit. And for others, it is something that is not really the best fit for them. So having that perspective, are there any resources that you would recommend for people that come from that perspective of think about DPC and make the decision if it's right for you or not?
Yeah. I think you have to have a certain level of risk tolerance. You have to have a certain level of, I'm not going to say commitment, but I recognize that if a patient calls me on the weekend, I'm not annoyed about it. That's my job, is for me to be available to them on the weekend. Whereas some people, I think, have a more of a shift work mentality about their job, and they want to be able to be completely off. And so you're never completely off. And I think you have to be cognizant of that, and that has to be okay with you. So I think that's the mindset behind it is the first thing. I think it's important to try to shadow and meet some other doctors. So as I was in the planning processes, I went and visited Dr. Stringfellow at Milepost Medical, and, just chatted with her. She was very kind to give me a lot of her time and let me know about her startup journey and how her clinic works and all of that. And so I think it's important to do that. And I wish I had actually done that more with some more different practices, so I could have learned from a lot of different experiences. And I think pretty much everyone in the DPC community is very open to that and very willing to have people come by and, and learn from them. So I had this mentality that I shouldn't be bothering people and shouldn't be reaching out, and it was going to annoy people. And like now that seems so ridiculous, but at the time I didn't really understand how nice everyone is. So I didn't want to do that. But I think you really should make sure that it's the right move for you and it's going to be a good fit for your life. So I think, checking out how the clinics work. And then the other thing that I didn't do that I should have done is making a business plan because you really need to understand that. And I finally did make one because I tried to apply to this business competition in Houston. So I finally had to make one. And it was very helpful to do that because I thought I had a sense from like my spreadsheet of how things would go, but it really was not the same as like a business plan and a cash flow, a document that really shows how things actually are. I think it is important to do that. And I didn't want to do it. I didn't like the sound of it. It sounded very overwhelming to make a business plan and do a cash flow document. But like, if you can't do that, how are you going to run your business? You have to, at the end of the day, it is a business and you have to know how it works. So I think it is important to know how to do that and to do that before you start.
As people have listened to your story, if they wish to reach out to you after this podcast, what's the best way for them to go about doing that?
Best way would be through email. So my emails are berens@vidafamilydpc.com. And I have my email on my phone. So I get emails all the time. I've been trying to be better about just checking them during the week, but I'm always on my email. So I'm always there. And then I'm also on social media at Instagram and Facebook. So I'm at Vida Family Medicine on both Instagram and Facebook. And I'm trying to learn how to be better on social media. So
awesome. Thank you so much, Dr. Berens, for joining us today.
Yeah, thanks so much for having me.
Next week, look forward to hearing from Mel Browning, licensed marriage and family therapist in Petaluma, California. He will be kicking off the celebration of Pride Month here on My DPC Story, where throughout the month you will hear from some stellar people, including Mel, who are practicing inclusive direct patient care. Also, in celebration of Pride, check out the website for the My DPC Story swag that has just been released. Support the show, get some swag. And a couple more announcements. Dr. Lauren Hetty's free fireside chat will be on June 9th, so check out the website to register. And registration is open for the AAFP DPC Summit that will be held virtually July 16th to 18th. Head on over to dpcsummit.org to register. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.